So welcome and thank you for joining our little session. So I'm just going to introduce myself and then I will hand over to Louise to introduce herself, and then we can open up to any questions that you might have to ask Louise. So Adina, you already know me, so I apologise for stating the obvious, but for the benefit of Kate, I am Erin. I'm a hypnobirthing instructor in Bromley, and I have 3 children. The youngest is 1, my middle baby is 5, and my oldest has just turned 8. I had 3 very different births with my 3 children, sort of progressing from not so great to amazing home birth with my last, and I used hypnobirthing with my second and third children. So and it made such a huge difference to me that I decided to train and start teaching hypnobirthing. So that's where I kind of got my drive to work in kind of the birth world and so on. And I've been doing a series of these Q&A sessions with different birth and health professionals to try and provide women with some extra support, particularly during COVID and lockdown, where there hasn't been as much support and there's not been as much opportunity for pregnant women to ask health professionals and midwives and whoever else for support and questions and things. And I wanted to provide opportunity for women to be able to get more information. So that's just a little bit about me. Louise, do you want to introduce yourself?
Yes, hello. I'm Louise Charles. I am a personal trainer and I'm also a hypnobirthing instructor. So I'm a mother of 3 also. I've got a 5-year-old, a 4-year-old and a 10-month-old. I did hypnobirthing with all my children, and I qualified as a personal trainer about 11-12 years ago, and I worked for a couple of years doing that. Then I actually went back to my corporate job, and then after having my second, so about 4 years ago now, I went back to personal training because it was my passion really, and I really wanted to work with women pre and postnatally, supporting them sort of recover from birth and supporting them to train throughout their pregnancy as well. I became a hypnobirthing instructor this time last year. I did my training, and it's been really nice sort of marrying the 2 together. So thank you for letting me come on, Erin, and
you're welcome.
Sort of answer any questions that anyone's got about pre and postnatal fitness.
So does anybody want to kick off with any specific questions that you wanted to ask Louise?
I do have a question. I don't want to.
Yeah,
I'll start.
Go for it.
So I've got quite bad pelvic, well, I don't know on a scale, but not great pelvic girdle pain currently. Had it since about 24 weeks, and I'm usually pretty active, and it's kind of stopped me. So I'll come back to that in a minute, but my main concern really is thinking about after birth. Am I still going to be trying to drive my legs behind me, or what can I do now to make sure that after I've had, I've got this little person to look after, I can be mobile and more, because I'm trying to do physio at the minute and all the rest of it, and I'll keep pushing through it, but my main concern really is after.
So have you been referred at the moment by your GP to physio?
Yeah, so I've had a couple of sessions of physio. I've just booked in for with an osteopath, because somebody said that might be helpful as well.
Yeah,
I'm not yet though. But
so I had the same thing actually in my first 2 pregnancies, and it was particularly bad in my second one as well. So I really feel your pain quite literally. It's horribly uncomfortable and also really frustrating, particularly if you're used to being active and training. So I hold that. I'm sorry for you. So in terms of things that you can do,
Yeah.
It's difficult at the moment. I don't know, where do you live?
Nottingham.
Okay, so I don't know if any of your local swimming pools are open or anything, but swimming is really good when you've got SPD. But don't do breaststroke legs. That's really important. So anything where you're
I've been swimming and sort of drag my left leg behind.
Yeah,
that seems to work. Doing front crawl. For some reason, it's not always the left leg that hurts, but when I'm doing front crawl, that left leg just goes, no.
Are you getting like referred sciatic pain as well, and that leg, or?
Yeah, like down the leg, the left one.
So a couple of things I learned. Firstly, I would say I'm not a physiotherapist, so this doesn't substitute medical advice. But a couple of things I learned when I had my third pregnancy. I was very nervous about this happening again, and I was much more physically active then because I was working full time as a PT. I went to see a women's physio about 22 weeks, something like that, when I started feeling the first signs of it again. And she gave me a few techniques which basically focused around belly breathing. Have you heard of belly breathing?
No, I don't think so.
Belly breathing is one of these things that's really, really helpful for pregnant women, no matter what you've got going on. And it also really helps with your postnatal recovery. So maybe in a second, I'll talk you through some belly breathing and we can do it together, and that might be helpful. But basically working on things like that when you're doing anything, like getting out of bed, getting out of a car. I'm sure the physio's told you already to try and sort of move both legs at the same time when you're getting out of bed or a car. But also really support your pelvic floor and your abdominal area with this belly breathing will really, really help that discomfort. But in terms of your actual question about what happens after the birth, I hope that this has been explained to you by your physio, but most cases, well, I think it's like 99.9 cases of SPD, once that baby's born, it just goes. Like, you will not have the same discomfort because you don't have a baby's weight sat down on there. So you will still have pelvic instability like everyone who's just given birth, and there's still a lot of considerations of, you know, how to rebuild that core and take things easy doing it, but you can be rest assured that you will not be living with this pain with a newborn baby, because cases of SPD do go when you give birth, and actually it doesn't impact your birth either. You're not gonna have a more painful birth or anything like that, because I can understand why you think, because especially when you've got that sort of shooting pain right at the front of your pelvis, you think, oh my god, this is going to be tough, right? But
I feel like you've been kicked between the legs or something.
It's really nasty. But you know what, as well, it might be that it goes on at the same intensity throughout your pregnancy, but sometimes SPD can sort of come and go in waves as well. So depending on where baby's sitting and things like that, you know, the pain can be particularly bad, and then it can ease off. When I saw that women's health physio in my third pregnancy around that time, the pain went and I didn't actually experience it for the rest of the pregnancy. So don't worry that this is you forever, because it's not. Worst case scenario,
and it's not necessary. And it's not necessarily that in future pregnancies it will definitely happen.
No, and definitely not. But there are definitely some things that you can do to help prevent that. So taking your time to rebuild your core after pregnancy, after the birth, is super important. And this is the case for anyone listening or anyone else online now. Is, you know, when your baby is born, it's about not just jumping back into the type of fitness things that you may have been doing before you got pregnant, because you've been through a huge thing physically and you really need to rebuild that core. Your ligaments will be very loose, like we want them to be, to allow our hips to open up and you know, the baby to come out our birth canal. That's a good thing, but it takes a while for our body to change and to get that strength back in our ligaments, in our pelvis, and get that stability back. So just taking your time to do that, and maybe visiting like a women's physio and having a sort of mummy MOT. There's lots of them all over the country now. That it can be really, really valuable.
Okay, well, that's good. That makes me much more hopeful. Thank you.
Does anybody else have any other questions for Louise? Hi, Sophie, by the way.
Yeah, sorry, I was just eating before, so I didn't want to
That's
go.
all right, don't worry.
I just wondered, you said about swimming and not doing breaststroke. Is that advice throughout the pregnancy, or is there a certain point when that comes in?
I doubt in the first 12 weeks it's probably not going to make that much difference, to be honest. But once you've got more relaxing in your body, so your ligaments start getting looser, to allow space for the baby to grow. Although that does start happening in the first trimester, your hips haven't moved a lot. But it's good practice to start just doing normal legs rather than breaststroke, because that the motion of that outward movement is moving those hips out quite a lot. And if those hips are a little bit out of line, this is my pelvis, by the way. I don't just do weird hand movements. If your hips are a little bit out of line, like, which is very normal when you're pregnant, and you start doing them, you're going to start really tightening up all these little muscles around your back and, you know, at top of your glutes, and you're in danger of worsening things or developing things like SPD, or getting sciatic pain and things like that. So I just stick to the front crawl legs for the time when baby's in you.
Okay, that makes sense. Thank you. I didn't know that at all, so that's really useful.
Yeah, it's a good tip, because you can still do breaststroke and front crawl and, you know, legs.
I always think when I try and do if I try and do breaststroke, I think they just don't work together, my coordination, so I just start sinking.
It's quite hard, isn't it?
Yeah, because my brain's telling me no, wrong legs, and then
Yeah, I did with my first two pregnancies, I didn't train at all, mainly because of pelvic issues, and I just didn't feel like it. You know, it didn't feel like something I wanted to do. But in my third pregnancy, I swam nearly every day. And another thing that is really helpful for SPD is pregnancy yoga. But I would make sure that your instructor is qualified in pregnancy yoga and understands the condition, because there will be some positions that you don't want to be getting in. But yeah, I definitely think it really helps with sort of alleviating sciatic pain in the lower back, all sorts of aches and pains, actually.
I'll have a look for that.
There's probably some online courses as well, in pregnancy yoga. If you don't feel comfortable at the moment joining classes. Yeah. There's actually a fantastic website, it's American, called the Bloom Method. And if any of you follow me on Instagram, Louise Charles PT or Tickle Pink Birth, I've got a link actually. They're doing a series next weekend, the Mama Summit it's called, and it's all about sort of like birth and fitness and postnatal recovery, and they do some really good online classes, and they've got whole sections for, you know, when you've got pelvic disorders as well, so they're worth checking out, especially at the moment when you might not feel comfortable going to the gym or
yeah. No, that sounds good. Have a look.
Does anybody else have another question for Louise?
I had a few, but I don't want to take over, so I'll do a few, and then we can make sure Kate and Sophie get their words in.
Go for it, Tina.
One question I had, so before pregnancy, I was working out 5 days a week, getting up at 6 a.m, doing half an hour in the morning, working out quite a lot, and then I've literally I've done a little bit, and I've gone for walks. Like, walking's probably the most form of exercise I do, but obviously not commuting into work has meant that kind of my step count's a lot lower, so it's been a massive reduction and change pre-pregnancy to now. So in terms of, you said obviously once you then start getting back into fitness kind of in the postnatal period, once kind of recovery is all sorted, not going into the same routine that you were doing before, how would you suggest that we adapt what we used to do? Should we kind of treat it as baseline, we've never worked out, or do we go back to okay, modify what we did before?
There's probably not a sort of one size fits all approach, but I would say things that you really need to consider is that when you are postnatal, so you don't really want to be training until your 6-week check, but people know that, right? But there is sometimes this misconception that I've had my 6-week check, well, I'm good to go. But actually your body is still recovering in a, you know, if you're breastfeeding as well, you're still carrying around the same hormones that you had in your body when you were pregnant. And it's those hormones that have a physiological change on the way you're storing muscle, the way your joints move, and things like that. And that's where the focus needs to be. So where sometimes the focus maybe before pregnancy is on like keeping lean and looking great, what we need to think about post-pregnancy is building our strength back up. So while you're pregnant, you will lose quite a lot of muscle mass. You know, you'll be storing a lot more fat because your body needs it. You know, that there's a reason we all change a lot when we're pregnant. And it's because our babies need us to, and we need those reserves for when we're breastfeeding afterwards. So the focus really should be on building strength. So resistance training is super important, but I don't know if you lifted weights before you were pregnant. So where you might before have, you know, gone up to a squat rack and put 40 kgs on and started squatting, you'll probably just be doing body weight, you know, because you will have lost the muscle mass that allowed you to do 40 kgs. But it doesn't mean that's not coming back, right? You just need to take the time and slowly build that up. You know, you'd have noticed before, if you were weightlifting, that if you went on a 2-week holiday and then got back in the squat rack, you're going to really hurt after that first session. So it's just, you know, it's taking things slowly and building back up again, listening to your body, listening to cues, not working out every day, you know, and just taking the time. Your body will recover. You know, if you were fit and healthy before you were pregnant, you'll get that back. So just take your time, enjoy your baby, don't panic about your body because it will come back. And when, you know, you're pregnant for 9 months, it's going to take 9 months and a bit more to feel like you're not again. I had my baby 10 months ago and I still feel the effects of the pregnancy. So, you know, it's just about slowly rebuilding, you know, some, like if you're looking for some really specific things to avoid, things like running or plyometrics, so jumping, anything that's putting strain on that pelvic floor. You know, because if you think about your pelvic floor as a hammock, before you had a baby, all it had to do was hold up your organs inside, and then it's held a massive placenta, a massive baby, and it's weakened, and it needs to strengthen back up again before you start pounding the pavements and doing this to it. So, and that's the same really with every single joint in your body. So your knees, your ankles, your back, it is worth taking your time, because you'll reap the rewards of that in 6 months, a year's time, when you can actually go back to, you know, doing some jumping or some running and not facing, you know, issues with your pelvic floor or pains in your knees and things like that.
Some more gentle stuff, I guess, like yoga and Pilates or that kind of thing. It's more stretching as opposed to jumping squats kind of thing. Yeah,
I definitely think strength, I do think you can be in the gym, you know, you can be doing resistance work, but just with a lot less weight than you did before, and build up the way you would have done when you first started weight training, you know, that, you know, you start with your body weight, and then when you're doing, you know, 3 sets of 12 reps of body weight squats and you're feeling good and strong, then you might think about adding some 5k dumbbells, and then in 3 weeks time you might say, I'm gonna work on the bar, you know, and that, but it's just about taking that gradually, you know, and follow a program. There's so much good content online. I wouldn't just go onto YouTube and find any old video, but, you know, finding people who are really qualified, who run online programs and things like that, that can be really valuable. And you can be doing it, you know, with your baby in the corner of the room if you want to.
Is there anything that you can do before your 6-week check, or is there anything that they should be doing before their 6-week check?
I would definitely start working on your pelvic floor before your 6-week check. It's probably something that people are doing throughout their pregnancy, or at least, you know, when the midwife asks us, we'll go, yeah. And then you do a couple while she's talking to you, like trying not to make it look like you are, and then you forget. So a few sort of tips that I give people for that is, I actually stole this off someone. I can't even remember who it is, so I can't credit them with it. But they gave their clients all like these little red dots. You know, the tiny little stickers you get, red dots, and they sort of put them in subtle places around the house that they might visit quite a lot. Maybe like above the changing mat. And then every time you see that red dot, you do some pelvic lifts. And the other really big one, which I might actually talk you through now, because it seems like a good time, is belly breathing. Mm-hmm. So this is something that is really great to practice while you're pregnant, because it's a really, you get really good feedback with it when you're pregnant. But Erin, you can do this too.
Go on. I'll join in.
Okay, so if you guys put your hands on your tummy, put your hands on baby, or just tummies. Okay, I just want you to breathe normally. So, in fact, take one of your hands and put it on your chest and one on your tummy. Just be aware of when you inhale, where that breath is going, which hand is rising, your belly or your chest hand. Now, what I want you to try and do is breathe into your belly. So as you inhale, belly expands. Now, as you exhale, just pull baby towards you. Hug baby into your body. If you're trying to hide your pregnancy. Not that you probably can at 30 weeks anymore.
Bit late now.
Yeah, breathing in again, let the belly expand. Breathing out, hug that baby towards you. So try and make sure that the chest isn't rising here. As you breathe in, it's coming into the baby, and as you breathe out, you're hugging the baby towards you. Now we're going to add the pelvic floor in, okay? So you put both hands on your belly now. So as you breathe in, those hands expand out. As you breathe out, belly comes towards you, hugging your baby, lift your pelvic floor. Breathe out, relax your pelvic floor, belly expands. Breathe in, sorry. Breathe out, hug your baby towards you, pelvic floor. Breathe in, let your hands expand, pelvic floor relaxes. Breathe out, hug the baby towards you, pelvic floor lifts. So this is belly breathing, okay? And there's lots of ways we can practice this when we're pregnant that will help strengthen our core muscles without putting so much pressure on our abdomen. A good way is to be doing it on all fours. So now you've got that connection, you know what it feels like to pull the baby in. If you are in an all fours position and you exhale and you're lifting the baby up into you, and you can really feel that, you get really good feedback. And it's a great way to practice this when you're pregnant, because when you've had the baby and everything feels a bit loose down here, it can be quite difficult to feel that connection again. And what you're trying to do is sort of train your muscles to come back together, to lift the pelvic floor and feel everything wrap and lift. If you've practiced it when you're pregnant, you know, you've got the muscle memory, you know what you have to be doing to feel that connection again. And going back to sort of how you can protect with the SPD doing that, every time you lift anything, you know, whether it's a, you know, bag of potatoes or a shopping bag, or you're getting out of bed, when you're doing anything that involves strain on your body, make sure you're in that brace position. So you've got that, the baby is hugged towards you, your pelvic floor is lifted as you go to stand up. And that way you're just protecting that whole area. You're protecting your lower back, you're making the core work, but not in a way that's going to put too much pressure in the abdomen. Does that make sense?
Yeah.
Did you all feel that baby hugging?
I think it's so important to do your pelvic floor exercises. I'm guilty of not doing it myself, and I think, I can't remember what the statistics are, but I think that the percentage of women that have pelvic floor issues after birth is shockingly high, and it's completely preventable. Yeah, it's just a case of practicing, isn't it, to make sure that you kind of protect those muscles so that you don't end up with issues later.
I had a terrible situation when I was pregnant with my second. I had them very close together, and for a trained professional as well, after my first, I just went hell for leather. I wanted to snap back, get my body back, and I didn't recover properly. And through my whole second pregnancy, I just wet myself. And I thought, this is me for life. I'm 33 years old, and I'm just gonna be wearing, tenor lady for the rest of my life. So I really took my time with it after that pregnancy, and then was quite careful in my third pregnancy, but didn't have the same issues. So you can definitely repair it. Just need to take things slowly and do a lot of those lifts. Yeah, there's also some good devices you can buy now. I bought a LV, who make the breast pumps. They make a device that you just insert into your vagina, and you've got an app on your phone, and it tells you when to squeeze and how long to hold it for.
I've seen a few different ones of those. I saw one that looks a bit like a vibrator.
Yeah.
I can't remember what it's called now, but yeah, there's a few different things around, aren't there? It's just so it kind of helps. I guess you get some kind of feedback, so you're doing it.
Yeah.
Right.
Actually, a lot of it as well is learning how to relax the pelvic floor, particularly when we're preparing for birth, because it's all very well just being able to squeeze it and squeeze it and squeeze it, but we need to learn that when we inhale, we can let that relax as well, so that we're the abs are working together with the pelvic floor. So it's a good thing to practice.
Dina, did you have another question you wanted to ask?
Another question I had was about so I guess best exercises for labour, I guess, or preparing your body. So I'm planning a home birth, and had a really good course with Erin, and spoke about positions and things. And obviously a lot of them are kind of not lying on a bed, relaxing, chilling, legs up in the air. It's more kind of active positions on all fours or whatever. So I guess other than the standard strengthening your glutes and your arms and anything, is there anything in particular you'd recommend just to kind of strengthen our bodies to be able to kind of last long and not feel as tired and drained from the process?
I think keeping up with things like walking is great. Your cardiovascular fitness is really important, and it's really good for baby to feel your heart rate raised as well. So that's going to help you with the endurance side of labour. And in terms of practicing strength for the positions that you're going to give birth in, the best way to do that is to practice being in those positions, really. Upright, forward. I'm sure Erin's given you some amazing, she's got some great visuals as well, on birthing positions. So, practice doing those, and holding those positions, or feeling active, because I'm sure Erin's explained this as well anyway, but when you're in those positions, you're not necessarily going to be stationary as well. So when you're practicing, you don't just need to hold it. So, if one of them is sort of like, I'm going to put my leg up here, if you wanted like leg up like this, stand there and move around a bit and see how it feels. It's gonna, all of those things are going to be helping move baby down and things like that anyway. So
you don't want to be trying out positions for the first time in labour. That's not the right time to be kind of doing things for the first time. So it's a really good idea to practice and try out different positions, because you might find some that are easier than others to get into, or you might find some that are more comfortable than others. So definitely try them out before you go into labour.
I definitely found, I don't know about you, Erin, but when it came to the final stage of birthing the baby, within you find strength you did not know you had. You could lift a car, because your body, it's the one time we do get this shot of adrenaline that we sort of want in labour, isn't it? And your body can do anything, and you're going to feel like you can take on the world, because you're birthing your baby. So I wouldn't worry that you're going to get to that point and you're not going to have the strength, or because the body is an amazing thing.
Yeah.
And that's, I get excited thinking about it. I love giving birth.
You also might find that you instinctively get yourself into the positions that you need to get into. So I would say don't overthink it too much, because you kind of almost want to follow your body's lead. And if something feels like you know that's the right position for you, then there's probably a reason for it, either baby's position or, you know, so don't overanalyze it too much and kind of follow your body's lead, because your instincts have, you know, they can kick in.
If you've ever done any yoga and know a cat-cow pose, that's such a lovely pose to be doing when you're pregnant, and especially when you're getting into that, you're in that final trimester and everything just hurts a bit. You know, you just relieve some strain off your lower back, but also it's going to be great when you're birthing as well, because you're in that all fours position, your pelvis is nice and open, and a lot of people birth in that position. So
it's also a good one for getting baby into a good position if you do it throughout pregnancy, because it's going to encourage baby to rotate back facing out to your outside your belly, which is a kind of more optimal position for baby to be in for birth. Does anybody else have another question for Louise?
I've got one, if that's okay. So I'm not so far along. I'm about 17 weeks, and I've just been hearing a bit about how your abdominal muscles need to be knitted together after birth, and you have like a certain amount of time to do that effectively. And I just wondered if there's anything you can be doing during the pregnancy, and kind of what exercises just afterwards really help with that process.
Okay, so the belly breathing that we just did is your go-to, okay, because what you're doing with there is you're strengthening your abdominals at the side here, so your obliques, which are going to help pull you back in. So if we can associate using our obliques with our breath, then every single time you're breathing, you're strengthening your abdominal muscles, right? So you're not going to just be rebuilding your strength when you're doing exercises or when you're in the gym. It's when you're lifting the baby, when you're getting out of the car, when you're doing anything, you're going to be using these abdominals to knit your abs back together. I guess when people say to knit your abs back together, probably refer is that some people have something called diastasis recti after pregnancy, which is where their abs have separated. So as the belly gets a lot bigger, your abs move further away, and some people's don't go back together. Some people's, not everyone's, and it's a relatively small amount of people that this happens to. Some of the things that can cause that to happen is going back to exercise too quickly, particularly doing things like crunches. So anything, and when we're talking about your knitting your abs back together, we're talking about your rectus abdominis, so your 6-pack or 8-pack, or we've all got them. They've just got a nice little coat around them sometimes. So what we're talking about is knitting those ones back together. And if you're doing things like crunches, so imagine these, you're constantly putting strain and pressure behind those abdominals. So if you worry your belly's a bit loose and you start doing loads of crunches, you've got your 6-week check, you're back in the gym and you're in your body pump or whatever, and it's the ab section, you're going for it, but they're not yet joined back together, then you're just increasing that pressure that's pushing out through the middle here. So really work on that pelvic floor, that belly lift. For, I would say, I wouldn't have a client doing crunches unless they had incredibly strong core 2 years after having a baby. I would never do them, because they're not that effective anyway. So it's working on things like, holding positions like planks, but only if your belly isn't doming when you're doing that, and just doing that gentle belly breathing, things like that. will help them come back together, and doing them while you're pregnant. The other thing that's super important is to avoid doing anything that's putting strain on your core when you're pregnant, because that's going to add to any kind of risk of aspiration. So when you're getting a test, even if you feel really strong core still, don't just sit. You know, you want to use your hands or turn to the side and get up, rather than, because you're essentially doing a sit up, you know, crunch then. And I don't know if you've noticed this yet, but you might see your belly sort of in a pyramid shape when you try and sit up like that when you're pregnant, or even postnatally. And that's because all that pressure is going right up the middle of your abdominals. So we want to try and keep that down by just supporting the body. But don't worry too much about that as well. And you can always get your GP to check your abdominals after you've given birth. And also women's physios are amazing for that. And they'll just, you know, what they do is like a finger test to see how many fingers width are between your abdominals. But you should be fine as long as you don't just go straight back into doing loads of ab work or carry on doing it while you're pregnant. Then it's fairly unlikely to happen, unless you're carrying like multiples. When people carry twins, it's more likely, for obvious reasons.
I just ask, you said not to do like crunches or a no-go. Is that the same for like leg raises and like other kind of exercises that we do? So other than the plank, and I guess like a plank where you kind of twist side to side. So anything else that's kind of putting, you know, like sit-ups and leg raises, they're in the same category as crunches and would be a no-go?
Initially, postnatally, yes. And you'll feel this because I don't really have space here, but what I might I'll film a little video and put it on my Instagram and show you, because I still feel my belly. I'm 10 months postnatal at the moment, and if I was to lie on my back and do straight leg raises like this, my belly would dome slightly, and it would feel hard when I'm doing it, but it would be doming. And that's because I haven't got the inner core strength to be pulling the abs down in order to lift the legs. So my body's just putting pressure out. So until you've got that core strength, you just need to adapt those exercises. So leg raises, a great way to adapt them is to, instead of doing a leg raise, do a leg drop with bent legs. So do a single leg drop and incorporate the belly breathing at the same time. So you would have your legs up, you inhale, as you exhale, hug belly in towards you, belly button spine, pelvic floor up, leg drop, come up, inhale, exhale. So all the time you're doing that exhale and pulling that core in, you're supporting your core while you're doing the exercise. And that goes for, you know, if you were lifting or squatting or anything. Does that make sense?
Yeah.
It doesn't mean you can never do core workouts again. But the same goes for plank as well. If you're finding that when you're in that plank position, you feel like your belly is doming loads, then just adapt it. Drop down to your knees, or just go onto all fours and do what we described as baby lifts, but the baby might not be in you anymore and you're just doing belly lifts, because that's going to be working really hard as well.
Anybody else have another question for Louise?
Just this morning. So if running postnatally weakens your pelvic floor, is it doing the same thing in pregnancy too?
Yes, it is. I think you're fine really until the baby is putting a lot of weight onto your pelvic floor. So do you run then? Is that?
Yeah, at the moment it's not very much. It's like once a week.
Okay.
Not very far.
How far or long?
It's about at the moment like 5k. So.
Okay. So, and you're 17 weeks. So if you're not experiencing any issues with your pelvic floor while you're doing it, you're not having any leaking, and if you haven't got a big bump at the moment and you feel okay, then that's fine. But the things you need to be aware of is that your joints are going to get looser. So you're going to be more prone to injury. So you need to be aware of that, you know, turning around, things like that. As your center of gravity changes, because your bump gets bigger as well, that's also going to make it a little riskier, more risky, you know, of turning over on your ankle, things like that. And then the obvious, as the baby gets bigger, that's putting more and more pressure on the pelvic floor, because your pelvic floor really is like a hammock. You know, it's just a sort of string of hammocks, and there's, you know, as I said, they're designed to support trampoline. And it just, you know, there are people who live through pregnancy. It's not something that I would recommend to my clients.
Does anyone else have any other questions?
Oh, just a quick one. Swimming after you've given birth, is there a certain length of time you should wait, or does it depend on what birth you end up having? And
Not really. I mean, I would wait until you've had your checks.
Yeah.
So, and if you have a cesarean, then it's likely that you'll be told by your consultant or GP to wait until 12 weeks to do any exercise, which is really, really important. And in swimming as well, you are doing quite a lot of stretching. If you think when you're doing forward crawl, like, you are really sort of opening out through your core. So if you've got a scar there, then you don't want to risk opening that. But also your body sort of gives you the indication, because you could still be bleeding. You know, some people bleed for 4 weeks, some people bleed for 10, some longer. So you can't wear tampons and things like that when you're bleeding postnatally. So it's unlikely that you probably be swimming in a time when you shouldn't anyway.
Right. So just wait for all of that to calm down. And
yeah.
And the midwives do actually, the bleeding is a good point actually, because I remember the midwives do say that you'll know you're overdoing things if the blood loss increases significantly. It's kind of a sign that you need to rest, and you need to stop being so physical. So that's definitely something to keep an eye on after you give birth, while you are still bleeding. If you do get an increase in blood loss, that you probably need to slow down a little bit.
Definitely with walking and things like that. And I think, Erin, that's just reminded me how I felt after my first baby, because I'd had the SBD and I'd not done anything. All of a sudden I didn't have this massive baby in me, and I was like walking around town with my bugaboo, my baby, look at me. And after like a week of that, I was sore, you know, really sore, because I hadn't rested enough. So just be aware, like, even if you think, you know, oh God, I feel great, you need to listen to your body. And if you're getting like a pulling feeling in your pelvic area and an increase in blood, then you need to listen and get into bed, skin to skin, get everyone to wait on you and relax.
Yeah, you do. You definitely, you do need to rest after giving birth. You've got plenty of time to get back into shape. I always tell my clients when I'm in my hypnobirthing classes that after you give birth, you have a dinner plate sized wound on the inside of you, where the placentas come away from the inside of the uterus. And that's, you know, even if you haven't had a C-section, that's still a huge wound that needs to heal. So you do need to give yourself enough time to heal internally, before you start getting up and about and you know, getting active again.
I would also just be really, I mean, you three ladies all seem very smart, but you know, anyone who's listening, just to be really wary of falling down the rabbit hole of weight loss after pregnancy, because there's a lot to unpick with this. First of all, if you just chase weight loss, you're not going to end up happy with the results you see, because you'll have lost a lot of muscle when you're pregnant. And if you start just sort of dieting and ramming in the exercise, you're just going to end up absolutely exhausted, flabbier, and weighing a bit less. That's it. And hungry. So it's, you know, it will go so quickly those first 6 months, and then you've got the rest of your life to sort that out. But just doing loads of cardio, things like that, and exhausting yourself, it's just, you're not going to enjoy those first few months. And it's just not worth it. It really, really isn't. I didn't do anything for 5 months after this last baby at all. I just did a bit of walking, and it really didn't take that long just to feel like I was getting some strength back, and then be able to be in a routine where I was working out months I was there. And that's really not that long in the grand scheme of things. So take your time, enjoy your baby, and be fit because it feels good. Really cool.
Does anybody else have any more questions for Louise?
Other than obviously the kind of the bleeding and the feeling, that feeling which will signal to you you're doing too much. Normally, like, and obviously this is kind of way down the line, normally when you work, and I do less cardio and more kind of weight training, and also you get like the burn and you feel it in your muscles and it feels great, like pre-pregnancy, and you kind of know, okay, I'm doing something that's great. When we're getting back into it, should it be that we kind of stop before we get to that point at the start to ease us into it, and then start building up more, I guess, to where it doesn't hurt, but obviously it feels like you've got kind of the muscles are working a bit more, just to know like when to stop, I guess. Like, at what point do you say, okay, my body's done enough now, I'm gonna chill out for the rest of the day?
What I would do is I would start with like 20-minute workouts that are full body workouts, doing something like, right, today I'm going to do some squats, I'm going to do some body weight deadlifts, I'm going to do some overhead raises with my baby, or with 2 bottles of wine, and I'm just going to do that 6 times, or I'm going to do something really simple for a minute, and I'm going to see how I feel. And what I'm going to be doing is chasing DOMs, because that's not that effective anyway. To be honest, you haven't had an effective workout just because you hurt. You can have really effective workouts without feeling pain. And also, you do not want to be like walking down the stairs holding your baby going, oh god, every time you take a step. We've all been there, where you're holding onto the banister and the wall as you go down. And that's not a good look when you're holding a baby. So there'll be time for that, in a year's time, or when they're in some childcare and you want to start smashing out the deadlifts and the squats and getting those DOMs back, do it then. But you want to be able to lift your baby without hurting that. So just taking it easy, doing 20 minutes a day for 3 weeks, not 3 weeks after your checks, and then maybe up that to 40 minutes for 3 weeks, and then see how that feels. You might feel that 40 enough. There's says exercise has to be for an hour anyway, so just find the time that you've got, or the time that you want to do it, and then just do a little something, and you'll be in tune with it. If you're doing hypnobirthing as well, you're going to be you're so in tune with the things your body's telling you, and I think that's heightened a lot after you've had your baby as well, because you're so in tune with your instincts to give your baby what your baby needs, that you're in tune with yourself as well. And I think you'll be able to answer a lot of your own questions, actually.
Yeah.
We're coming up to the hour now. Does anybody have any other questions before we finish up our session? No? Oh, thank you so much for joining, everybody, and I hope you found it useful. Thank you, Louise. Really appreciate it. I've learnt loads.
I loved it. Thank you. Thanks for having me.
So I'll send an email to all of you after this session with Louise's links. Louise, what's your Instagram handle?
So I'm at Louise Charles PT.
Cool. So if anyone wants to give Louise a follow on Instagram, and I'll send you all some links from Louise after the session. And do follow me on Instagram as well if you don't already. It's Better Birth UK. And good luck with your pregnancies. and I'm sure you'll be fantastic. And yeah, don't just go easy on yourselves, and don't put too much pressure on yourselves, and you'll be fine.
Thanks,
Thank
Bill.
you.
Cheers.
Take care.
Bye, ladies. Thanks.
Thank you so much. Thanks.
Bye.
Bye. Ooh. I'm gonna stop recording.